Hi, this is my presentation on cannabis can be used to improve the quality of life of schizophrenia patient. Firstly, I will talk about what schizophrenia is. It is a serious mental disorder in which people interpret reality differently. Schizophrenia patients will have trouble in thinking, behavior, and emotions. The symptoms are classified into positive and negative symptoms. Positive means having more than what you normally have, and negative symptoms are what is being subtracted from normal. The positive symptoms may include hallucinations, which often involve seeing or hearing things that don't exist. The most common form of hallucination is auditory hallucinations. Next is delusion. Delusions are false beliefs that are not based in reality. For example, you think that you are being targeted, or you might have exceptional ability or fame. Next is disorganized speech. Disorganized types of schizophrenia will have trouble with communication. Effective communication can be impaired, but an answer may be unrelated. Sometimes it is called word salad because the way the words that are being arranged. Next is catatonia. People who are catatonia type can have behavior that are resistant to instruction, inappropriate or bizarre posture, or useless and excessive movement. And here's a video example of a patient who has catatonia. Like I said, negative symptoms refer to reduced or lack ability to function normally. The symptoms are range from alopecia or inability to speak, lack of emotions, lose interest in everyday activities, and they can be socially withdrawal. And why is it important to know this disorder? Well, if you look at this graph, you can see that the majority of patients are in their 20s. Since most of you are in your 20s, we possess a high risk of becoming one. However, men will face this problem earlier than women, since men tend to develop symptoms in their early 20s, while women happens in their late 20s. While the prevalence rate of schizophrenia is 1.1% of the total populations over the age of 18, or to say in numbers, there could be 51 million cases of schizophrenia. Schizophrenia patients are known to use some substance, and of all the substance abuse, cannabis was the most commonly abused drug. Currently, the causations of schizophrenia is still unknown, and the current treatment does not treat the disability. Next part will cover 3 articles, papers that I have done research on. The first paper focuses on the influence of gender and cannabis use on the earlier age onset of schizophrenia. What they did was they sampled the resident of Hague, Netherlands. They recruited 133 patients. They classified the onset into 3. Onset of social occupations dysfunction, first psychotic episode, and the onset of negative symptoms. These are the results from the first paper. In the figure 1, it is comparing the male and female patients, and you can clearly see that male patient will have earlier age onset comparing to female patients. Next, in figure 2, we can start to see the differences between cannabis user and non-cannabis user. The group that has been exposed to cannabis has a lower age onset compared to non-users, despite being male or female. However, in the next figure, we are comparing male patients who use cannabis and male and female patients. Of all the groups, the cannabis user group has the lowest age onset, and we can say that the cannabis has a contribution in developing schizophrenia. In the next paper, it focuses on the lifetime positive symptom in patients with schizophrenia and cannabis abuse, which are partly related to substance abuse. What they did was they sampled 205 patients with schizophrenia from the age of 18 to 53 years. The sample was recruited from a psychiatry department of French University. The sample is divided into cannabis and non-cannabis group. From what they found, the patient can be classified into groups according to their type of symptoms, which are paranoid type. disorganized type, positive and negative symptoms, and catatonia. From the total patient, 41% are known to be substance abuse, and each substance is classified in the right graph. The most common drug was cannabis, followed by alcohol and so on. In the second paper, there are 4 main findings in this paper. The first one is schizophrenia patients who use cannabis are 5 times likely to use other forms of substance. Next, patients are likely to be male and younger at age onset. Third, negative symptoms are less frequent in cannabis user. Lastly, patients who are abusing cannabis before the onset of schizophrenia have shown less frequent negative symptoms and no excess of positive symptoms. Take a look at this table. The left side are patients with substance abuse, and on the right side are without any substance abuse. We can say that the cannabis group has lower p-value in evaluations and apathy, which are decreased in interest or motivation to initiate or perform tasks, or an example of negative symptoms. And here are what they also have found. If you took a look at this graph, you can see that the duration of illness is shorter in the pure cannabis group, and also the age onset of cannabis group is the lowest comparing to all the other groups. Next paper, or the last paper, focuses on the effects on cognition and symptoms for cannabis use disorder in schizophrenia patients. What they did was they recruited 455 patients aged 18 to 65 years from the Sucker Hillside Hospital in New York. The sample is then divided into 2 groups, user and non-users, and the sample are asked to do some tests. And what they have found is that the cannabis group score better at GAF score. GAF score, or Global Assessment of Functioning score, is a measurement on how a person's psychological symptoms impact their daily life. Not only that the GAF score that the cannabis group scored better, but also they had a better performance on measures of processing speed and verbal skills when compared to non-users. And like trail making part test, which measure in time for how long the patient might need to use to process. The cannabis group score better, significantly better in test B. In summary, cannabis usage does contribute to the earlier age onset of schizophrenia, which is kind of controversial to our hypothesis, but there are reasons why schizophrenia patients still remain using cannabis. And here's why cannabis can be used to improve the quality of life of schizophrenia patients. Cannabis is associated with a shorter duration of illness, less negative symptoms like evolutions and apathy are shown in the pure cannabis group. Moreover, they also have scored better in GAF score and have better performance when compared to non-users. And that will be all for today. Thank you.